Hello, everyone. I'm Meher Graywall from Youth Aware, and today I have the wonderful honor of hosting an exceptional leader, an outstanding clinician, an infectious disease physician who has been leading the fight against COVID at UW Medicine. And most of all, he is the voice of reason in this storm called COVID. Dr. John Lynch is the medical director of Infection Prevention and Control and the Associate Medical Director at Harborview Medical Center Division of Allergy and Infectious Diseases at the UW School of Medicine. Thank you so much for giving us time today, Dr. Lynch.
Oh, absolutely. It's just really an honor to be here. Thank you for inviting me.
Thank you. So, Dr. Lynch, I will just start off by asking you if at any time during your medical school, residency, or fellowship training, did you expect that you will be in the eye of such a storm? And what helped you to take charge and manage the situation?
Yeah, to answer the first part of your question, no, I never expected to be in something like this. I, obviously went to medical school. I was really interested in infectious diseases when I went into medical school and really steered me into the work that I do now. And so I certainly read about things like this, prepared for things like this to some extent. I went to public health school and got my master's in public health and epidemiology after my internal medicine and infectious disease training, and learned a lot about pandemic preparedness and the impact of epidemics and pandemics as part of that. But I don't think I ever really fully understood how serious the threat was until this happened. In terms of like preparation, again, it was all of that education and reading and interest that I had, but I had little bits and pieces along the way that I think set me up for however we define success in this awful situation. I think part of it was my medical training. I was very lucky to go to a great school that supported me, my interest in infectious diseases, my training in public health, and putting those things together, having the sort of clinical perspective and the public health perspective. So from the patient to the population was really powerful. I'd say the other part is my career. As you mentioned, my primary work is in what's called infection prevention and control, which is really around how do we keep people in healthcare, patients, from getting any type of infections. I also work in this area called employee health, where we try to keep healthcare workers safe from all types of harm. And so for over a decade now, my focus as a physician has really been on how do I keep patients and health workers safe. I apologize for my dog. I can just repeat that. So my focus for the last year has been on how to keep patients. Oh my goodness. Sorry, 1 second. So my focus for the last year for the last decade has really been on how to keep both patients and health workers safe in the healthcare environment. And we've dealt with a lot of problems and challenges over the time. As someone lives in Washington, you may recall we've had mumps outbreaks here. We've had measles exposures. In healthcare, we deal with things like tuberculosis exposures and influenza exposures and transmission events quite regularly. I was very active in developing a program to keep health workers and other patients safe if we had Ebola patients at Harborview Medical Center, which is one of the first sites to take potential exposed or infected people in the 2014 exposure. And so all of those pieces set me up for this sort of work that I do now. And then lastly, which I can certainly talk about if you wish, is sort of the pace with which I got involved with COVID. Wasn't, when a lot of other people got involved with COVID, it was really a bit earlier on.
So Dr. Lynch, please tell us a little bit about your journey and when did you know for sure that you were meant for medicine and in particular for infectious disease? I've heard from so many people that infectious disease docs are some of the smartest people.
Well, that's very kind. I get to work with a lot of wonderful people in my division who are infectious disease doctors. And so, I had kind of a long path towards medicine, but I would say that the most important thing for me was I was really open about the ideas and different types of fields in medicine. And I was lucky. I'm a person who really enjoys a lot of different things that we do in healthcare. And so my first introduction to medicine and the idea of being a physician was really in emergency rooms, and I really enjoyed that. But when I first got the chance to work with people who were living with HIV was when things really turned in the direction I've continued to follow now. So I worked in an HIV clinic as a medical assistant back in the early mid 90s. And that was back before we had effective antiretrovirals. And having that person-to-person interaction with people who were suffering so enormously secondary to this infection, having secondary infections, having cancers to do with their destroyed immune systems was really, really profoundly impactful for me. And I felt really a desperate need to somehow respond. And I think that that's what really set the course of my rest of my career. I really went from learning about and working with people living with the HIV to really wanting a desire to do something about it, taking that sort of clinical experience as a medical assistant, and then going into a laboratory and learning about the immune system and working on developing vaccines. And then obviously medical school, working with populations in Kenya with HIV, and then obviously follow my clinical path in infectious diseases. I shifted gears away from HIV specifically and now really focus on healthcare associated infection prevention and antibiotic resistance, which is a whole nother pandemic that's continuing to progress.
Thank you so much, Dr. Lynch, for telling us about your inspiring journey. So as an infectious disease doctor, and especially being someone who heads infection control at an institution like UW and is responsible for thousands of employees, what are some skills that you've honed outside of your medical knowledge, like people skills or administrative skills that you've had to develop?
Yeah, I'd say there's probably a whole bunch of them. What we learn in medicine is very focused. It's often very thoughtful, but can be algorithmic, right? How do we approach a patient with a fever? How do we approach a patient with a trauma? Because we all want to be aligned and evidence-based in what we actually do and the outcomes that we're expecting. When you're dealing with things like pandemics and infectious disease outbreaks and exposures and all these sorts of things, you're faced with a couple of things. One is deep concern, sometimes fear, and the unknown. So, if we just look at the example of the COVID-19 pandemic, when we entered in this, we really knew nothing about what this. We didn't even have the name for the virus or the disease back when we started on this, or when I started on it. We didn't know about treatments. We didn't know about risk for infection, exactly how it transmitted, what were the risks. And so you're dealing with an unknown. And so the tools that I really employed with responding to this was what I call, and I'm not sure I originated this, but the idea of radical transparency. We have to share what information we have with everyone who wants to know. And so whatever happens, you have to go ahead and share it. It may not serve a direct purpose. It may not even serve your own purposes, but it is what's going to serve you and the population that you're working with the best. So being as transparent as possible, being proactive in your communications is also really important. It's really important to engage stakeholders. So that means people who have an interest, a stake in the game or the work that you're doing early, get their feedback. It doesn't mean necessarily, especially in a fast-moving pandemic, that everyone gets an equal vote, but it does mean that their voices are heard. And that's really, really important for building trust. And then I'd say the other part is around the technical aspects of communication. I have always had a great deal of admiration for my communication colleagues, but none more so than I have over the last year and a half. When we look at pandemics and infectious diseases, we often look to people like infectious disease doctors or something similar, but there are amazing, incredibly important people who have impacts on the health of populations and the course of pandemics, ranging from epidemiologists to economists to politicians and policymakers. Public health professionals are obviously incredibly central and critical to these efforts, but our communications colleagues are enormously important. Engaging with the communications team and working through how to get information out in a proactive way is really, really important. You learn some of that in public health school, but not until you're really doing it do you fully understand how that works. And you learn none of that when you're in medical school.
Thank you, Dr. Lynch. So please tell us a little bit about your day. What does a typical day look like for you?
Yeah, so one of the things I've always enjoyed about the work that I do is that every single day is different. I do see patients part of the year, but the vast majority of my time is engaged with what are called programs and operations. So it's developing policies, implementing interventions, measuring their impact, and similar. I also spend a lot of time communicating, as I mentioned, with various stakeholders and with the general population. So, as of January last year, everything for me shifted. So I went from doing a ton of work around how do we keep patients and health workers safe within Harborview and within UW Medicine, doing some research, what I call pragmatic epidemiology, looking at, the rates of infections in hospitals and what interventions have evidence to slow those things down or stop them. For the last, 18, 19 months now, it's really been 100% COVID. And that may seem like you're doing the same thing every day, but it really isn't. On a given day, I present the epi curves, so where our cases are going, where the hospitalizations are going, where the death rates are headed, to our emergency operations center. I meet with our program chiefs and our operations chiefs in our emergency operations center regularly. We have a vaccine program within UW Medicine that has vans out in the community doing vaccination. We have education teams as part of that. We have testing teams, drive up and mobile sites, and I'm working with all those teams. I meet with a comms team every single week to think about how do we develop good messaging for that week to give people updates on what's important and what's not. We do town halls quite frequently, a little bit less so during the summer, but we're going to move back to meeting, presenting out to whoever calls in. These can be calls of 900, 1,000 people from UW Medicine who participate and listen and submit questions on every Friday. I meet with, after this call, I'm going to be meeting with some of my colleagues from the CDC about updates that they're thinking about and some information they have so that I can be an effective partner and supporter of their work and communications. And then it's, what I would say is it's different every day. Sometimes it's a series of meetings. Sometimes it's responding to something that's much more acute, like this rising case counts that we're dealing with right now in King County. And then mixed in there is things like talking to media, which is a really important thing. I think people sometimes get a little bit mixed up around the purpose of speaking to media. Journalists have a really, really important role in all the time, but especially in pandemics, from my perspective, in communicating with the public, and they can only communicate what they learn. And so it's really incumbent upon content experts from all disciplines to share, important information with journalists so that they can communicate with the public so that the public's getting the best possible information. And this is especially important these days with the amount of both misinformation and disinformation that is going on out there. I know you and I follow each other on Twitter, and I tried to be a little bit active. I'm not awesome on social media, but I do try to retweet things that I think are really important in order not only to share information, but also to declare where I stand on this because of my position in my facilities. And I try to, put out my message when I think it's something really important, like the recent, masking requirement in King County.
Thank you. So Dr. Lynch, what are your interests outside of work and what helps you unwind?
My interests outside of work are probably just a few things. I love being with my family. You saw my daughters when you got vaccinated and they got vaccinated. I have a 12 and 14-year-old daughter. I have my wonderful wife, Chris, who's a nurse and is working on the front lines at UW Medical Center. And so I love spending time with them. And as a family, we love being outdoors. I really, really enjoy things like climbing, outdoors, bouldering, and during the winter, skiing and things like that. So I find a great deal of relief and peace in being simply out of the house and out of the hospital, especially when I'm with my family and friends.
So Dr. Lynch, after the pandemic started, there has been exceptional interest in medicine and medical school applicants have increased. What would you advise young people who want to go into medicine and why they should consider a career in infectious disease?
Well, the thing that's been so fantastic about infectious disease is that it is constantly evolving. I deal with, on the clinical side, changing problems, changing patients, changing infectious diseases, new infectious disease, drug resistance, new pathogens, new presentations constantly. I don't think I'm taking anything away from my colleagues in other branches of medicine, but it's one of the most unique parts of medicine is how we're dealing with new parasites, new bacteria, new viruses, new fungi constantly, and new presentations. And I don't see anything ending. At the same time, it highlights some of the big challenges in the world. Infectious diseases, I think, is a discipline that very easily goes from the patient to the population. If I give you an antibiotic, right, and maybe create some pressure in treating an infectious disease that leads to some drug resistance in the bacteria in you, right, that bacteria can now be shared with other people. And so we need to be thinking about these sort of interplays constantly in the work that we do. Obviously, as a doctor, I always prioritize the patient in front of me. But in my role now, in the work that I do and the interests I have, I'm always thinking about the populations. And I think that infectious disease lends itself to really interesting careers, both at the bedside, taking care of patients, but also thinking about important careers in public health, in policy development, in politics, in other leadership roles, in informing, experts in other fields like economics and journalism. And I think that that's just super exciting. Like, I really, really enjoy that part of it. And I love being around my infectious diseases colleagues as they do cutting edge research, develop new tools to fight off infections, and get prepared for the next problem that we face.
Thank you, Dr. Lynch. This gives me great insight into your role as an infectious disease physician. So, Dr. Lynch, where do you think we are today with regards to COVID and the threat of Delta? Is it always going to be a formidable foe who outwits us with mutations, or do you see us surmounting it?
Yes, you're asking really important questions, and I don't know if I have the answers. So a little while ago, a journalist asked me, if we had a book, what chapter would we be on? And at that time, a couple months ago, I said, maybe if it's a 10 or a 15 chapter book, maybe we're on chapter 4, the end of the beginning. We sort of set the stage. And I think that's probably still true. And now we've moved into sort of the body of the problem. I think this Delta variant of concern, defines the problem. The vast majority of people in the world do not have access to vaccination. And that will continue to create, obviously, significant problems for those individuals, their families, and their communities, but will create problems for the vaccinated population as well. So the overriding recommendation right now, in my perspective, is to get more people vaccinated, to provide access to people throughout the planet to vaccination so they can be safe, and then they can also keep all the rest of us safe. And so I think we are maybe at the beginning of the middle. In terms of where things go, we're seeing a couple conflicting stories going on here. One is that while vaccination definitely protects you against getting sick and dying from COVID incredibly well, including Delta, we are seeing in places where there's a lot of Delta circulating, some breakthrough cases. And the concern is, can you be infected, be one of those few people who are vaccinated who get infected? Can those folks then transmit the virus to other people? And we really don't know what the answer to that is. The other issue is that we're looking at both individual and population level characteristics of the Delta variants. And one is that if you look at the individuals, these viral loads, how much RNA, how much virus is in people's respiratory tract, goes up very high, very fast. And it's unclear how fast it comes down. Maybe it's a very rapid cycling disease. Maybe it goes high and then drops off dramatically. We are seeing lots of younger people. And unfortunately, as you probably have heard, we're starting to see kids get very sick with COVID. And so this feels like a different sort of part of the pandemic in a way that we haven't experienced before, and that we still have to learn about. The other part is when you look at some of the states that have been hit the hardest with COVID, most recently here in the United States, a lot of them have hit peaks and are coming down without necessarily adopting some of the what we call non-pharmaceutical interventions like masking, distancing, closing businesses and so forth. And it may be that this thing rips through populations so fast that some level of natural immunity is at play and is sort of slowing things down after a certain period of time. Now, it's not the way we want things to play out, definitely, but it may be what happens with natural, kind of out of control infections in unvaccinated populations. So a lot to learn. How fast we move through this Delta phase remains unknown. I think the deep concern continues to be not only is how Delta play out in non-vaccinated populations and all the challenges around providing access and answering questions for people who remain unvaccinated, including those under 12. But also, is there another variant out there that's going to be impacted by, sub-therapeutically vaccinated population that may actually get in the way of the benefits of vaccination? Those are unknowns. So I think this winter, as things open up, as schools get enrolled and kids are going to school, as masks are not around in some places, we're going to be dealing with COVID, probably Delta for a while. We're going to be dealing also, really importantly, with influenza, respiratory syncytial virus, human immunovirus, the other human coronaviruses. Are going to be very hard to figure out which one is at play at any given time. So a lot of complexity. I think we're now in the middle chapters. Maybe the early middle chapters of the COVID story.
Thank you, Dr. Lynch. I really love this analogy to a book. I've just never heard it being put that way. And I think it's a great and informative way to explain it to people. So finally, my final question is, Dr. Lynch, can young people make a difference during pandemics like this, as well as in infection control and antibiotic resistance? So how can we help?
Well, I'll say two big things. And one is be more like you. Or the work that you've done, the leadership that you've demonstrated and practiced, I think is a model. So the work that you and your colleagues and friends, your group Worth a Shot and others have really, I said, set the standard for what people can do and the power of young people, right? The innovation, the creativity, the energy that you bring to this conversation, the authenticity is incredibly important. It goes back to that point I made around transparency, radical transparency. We have to go to who we know, and often those are the people we trust the most. And so I think, not everyone has to be, as amazing as you, but thinking about the things that people can do, young people can do, like the work that you're doing. So, stepping up and getting vaccinated, being informed about vaccination, sharing your experience about vaccination. If you've been unfortunate enough to experience COVID, either personally or within your family or community, sharing that experience, because none of it's good. I think that, we live in a more diverse country than we ever have before. And we know that is our goal, right? This is one of the best things about being in the United States. But many of those communities don't have the same access to medical information or access to vaccination. And we need to, I think a lot of young people can maybe bridge that gap, maybe with their family, maybe with their friends, maybe with a larger community. Maybe it's with a church or another religious denomination where they have a role or a voice, where maybe my voice doesn't get through. And I think stepping up and taking on those roles is really, really important. And possible. Again, as you've demonstrated, and we've seen this time and time again in other communities. So making those connections is another part. So the personal, the community stuff are really important. I think the other part here is, I think people like you and your colleagues are far better versed in things like social media these days than someone like I am. I try to get on it when I can because I think it's important. But I think using these really important and valuable tools for communication, for fighting against misinformation, disinformation are really important, particularly in communities, again, that are challenged with access to either the vaccine and or information, right? And so where we can be active on social media can be incredibly powerful in enlisting, people who are trusted voices in those communities. The last thing I'll say is from the personal perspective, I'm going to call on everyone right now, to get vaccinated, to wear a mask when you're indoors, when you're around, especially around people you don't know who are the vaccine status is, follow all the normal things, wash your hands. If you're not feeling well, stay home, get tested, especially as we think about getting back to school. The things that's going to keep schools safe, it's going to keep businesses safe, it's going to keep families safe, is keeping sick people at home, getting them tested. If they need medical care, obviously getting them the medical care they need. But going to school when you're sick, showing up at work when you're sick is only going to continue to perpetuate all of this. And we need to make sure that any stigma associated with that is dealt with, is removed, is minimized as much as possible, so that people feel empowered to do the absolute right thing. Because as you know, I don't know what your family situation is like. I'm not trying to improve into your privacy, but many people your age have siblings who are not vaccinated. Many people in families have a member of that family who may be immunocompromised because they're getting cancer chemotherapy. They may have had a kidney transplant or something similar. I can vaccinate them over and over, and they're not going to have the same level of an immune response to vaccination. Those under 12s and those folks who are immunocompromised are counting on the rest of us to protect them. And it's going to be young people like you who are going to step up and make that commitment.
Thank you so much, Dr. Lynch. It has been an honor and a privilege to interview you. Thank you so much for your time.
Right back at you, Mara. It's just a privilege and great to be here. Thank you.